Happy Friday, everyone. I hope you're all geared up for an incredible weekend and hopefully you get some good weather. As always, we're here with some updates and some conversations with regards to how the dental industry here in Canada is dealing with this pandemic situation. You can find me on the bottom right corner with the little video here. We have our amazing team of account managers with us, Mike, James, Noel, and Jay, as you can see on the screen. We will be starting today with a topic that has been in the news for the last couple of days. It's been a big deal in a lot of the social media groups that I'm a part of with conflicting opinions. So we'll be touching base on that. Noel is going to kickstart today's session. So in one corner, at a weight of what do we have? Uh, 25 25,000 or 35,000 hygienists. We have the CDHO on the other corner with about what do we have 10,441 dentists. We have the RCDSO. There's been a lot of fighting with regards to which guideline should prevail and everything, but Noel's here going to give us some summaries of round one at least.
The screening, like I said, the both bodies are agreed into screening patients, but the conflict again comes into who can and who cannot use the facilities. So, according to CDHO guidelines, patients who are screened positive must not attend the facilities at all, while the RCDSO guideline says they can. Patient can to be treated in the clinic for emergency and urgent care only. And with all this, including the N95 mask and the PPEs in gear, I should say. And yep, and having reading that information and this information's out to the public, there are patients made anxious. So as a patient, should I go see a treatment, go to the dental clinic and do the treatment? It makes me anxious. I, I would say I would delay it until the governing bodies has fixed this conflicting regulations. And Alex, that's for me. Is there anything that you need to add?
Always, yes. So the thing here is this is well, obviously, these governing bodies met together with Ontario Public Health to figure out what it is that needs to be done. And what is basically, you know, what we see the result of that is pretty much the fact that CDHO has not agreed with our CDSO, and they were not able to get to an agreement. And as such, they have provided conflicting guidelines to their members. Um, on top of the fact that, it's very bad internally for the industry. Um, Now that this concern has not been resolved and exposed to the members, now it has been exposed to the public. So there are a few, instances here that are very bad. Um, Pretty much, the CDHO has a stricter guideline, and they are referring, to the people who, are not really reading research on virology in their free time. What they're saying is, because there can be carriers of the virus that are not exhibiting any symptoms, we should treat every single patient like they are positive for the virus. And this goes back to same scenario with HIV back then, where they said treat every single patient as if they are positive. Um, the problem is that, you are saying, oh, well, we screen the patients. And by screening the patients and checking their temperature and everything, you're just checking whether they have a symptom. So, unless there is some really solid research that says, if you are exhibiting symptoms, it means that you are carrying, strain A of the COVID-19 virus. And if you're a carrier of the virus but you don't have symptoms, then you're a carrier of strain B of the virus, and have guidelines for each. It's going to be very, very difficult to get an agreement. The other thing is, it is obvious that patients require dental treatment, and as such, they need to be able to access services through dental clinics and hygiene clinics. Um, Incorporate that into shortages of protective equipment and masks and gowns, and the increased price of that creates an issue here that obviously these two regulators were not able to agree on. The other big issue here is that the CDHO has advised the members to report any clinic, any dental clinic that ask them to come back to work, but their processes are not following the CDHO guidelines. Whereas the dental members will only follow what their college says. So basically, they're driving the dentist to not bring back the hygienist to work. Now, again, not going into any of the politics in that type of a decision, it's just very bad for the industry. It cripples Ontario in their plan or progress going back into business, whatever that may look like. But now that there's been articles, on CBC and Global, it has been exposed to the public, and that although now it just adds to some of the uncertainty for the patients, as soon as there is whatever case of COVID in a dental clinic, the media is going to have a field day. Now, what is very, very important is, as you are preparing to reopen, and we talked about, last week about um, fear of reopening, you have to understand and outline a process. Whereas you've treated a patient right now, and 14 days from now, they are starting to exhibit some symptoms, and they let you know about it. What is your process of notifying public health, your regulator, and all the patients that you've seen in the last 14 days, or maybe 28 days? So you need to have a process for that. I'd highly recommend in revising in designing that process to work with your regulator and potentially public health as well. So they may guide you as to what they expect from you, and the policy must be written as such. So I think that is very very important point to make with regards to this very sad situation in Ontario. And I really, really hope that we won't see a round two of this public clash between regulators. Because what's going to happen is public is going to lose trust in it, and that's going to push government to say, guys, you can't regulate different professions, and it's going to end up having one regulator for all dental professions. Um, if this continues, it's just government has allowed these professions to self-regulate. They can take it back. Like if you can't play nice, they'll just take it away from you, and that one governing body is just going to be under public health, and then you won't be able to have regulations that are specific for the profession, and that's going to be terrible. But it might be inevitable, so who knows? We'll just keep our ears open and really hope that in the next few days there will be some voice of sanity, helping these two organizations combine and work properly. I already seen petitions signed by over 5,000-6,000 people, hygienists and dentists across Ontario, asking for a voice of reason in whatever opinion they're trying to promote. I've seen petitions, one for each opinion, all signed by thousands of people. So obviously, this is a very touchy subject, like other subjects like water fluoridization and stuff like that. So we'll leave it to the experts. This is just bringing you, if you haven't seen it yet or know a little bit of, what's going on behind the scenes. This is what we know kind of on, this particular topic. The rest of our topics deal a little less with politics and more about that fear of reopening and some of the things that offices are doing with regards to reopening. Our Jay, James, and Mike are gonna share their stories of working with clinics in the past week and what they have been focusing on and speaking with offices on. We'll start with Mike here with regards to rebooking the schedule, just because as you plan to open, you want to be open and see some patients. So how do we do that?
Thanks, Alex. So yeah, as you had mentioned, a lot of my conversations are with my clients. They're really centered around preparing the office for reopening and reaching out to the patients. One thing that I've heard a lot from the offices that have opened within the last week is they've gotten a very large influx of incoming calls. So they still are facing patients that are nervous about coming back to the clinic, but on the other hand, they do have a lot of patients that are calling, trying to book in the what urgent needs that they think should be followed up on, and it's been hectic from what I've heard with the offices. The number one thing is offices have been trying to streamline how to reach out to the patients and what the best method for doing that would be. Based off of a lot of my conversations, it seems as if offices are trying to focus on all the missed appointments that were supposed to have taken place the last couple of months, which is very important. Trying to get them called back in and rescheduled, I would say, is one of the most important things. That way, those patients aren't looking elsewhere for another clinic, as mentioned in our previous webcasts. Another thing is managing those incoming calls. I've heard from a lot of clients that the incoming calls, they're coming in fast and hard, and with quite a bit of concern behind them as well. I'm sure everyone's heard this throughout the last couple of weeks, but it's something that's I think is important to reiterate, is that when you're in those conversations with those patients, that it's important to to really educate them as to the changes that took place in the office, not just for reducing touch points and things like that, but what that process would look like, what that feeling is going to be like, but then reassuring them that you're still there for their oral health and that you're still wanting to keep up to date with everything that's happening with the patients. So the other challenge I'd be hearing, on the other hand, is trying to be able to make that time available. As I've mentioned, you're in the middle of dealing with a ton of incoming calls, as well as trying to reach out to those patients who had those missed appointments. So people have been looking for tools to try to speed up that process and just make it a little bit more easier. So throughout the conversations I've been having, what seems to be most effective is trying to free up some of the front staff's time. A lot of offices are trying to get creative, and whether they look at an e-blast to send out to all their patients to get that communication going, or I've got other offices, and I'd say quite a handful of them that are looking into the idea of sending out email and SMS text reminders to their patients for appointments, and as well recalls. And so that'll take a huge chunk of time away from the receptionist, freeing up that they could do for more incoming calls, as well as reaching out to those missed appointments. One other tool that I've been having conversations with my clients about, and this one actually struck me as fairly interesting. That would be an internal office communication tool. A lot of offices have been talking about how, with the huge influx of patients coming in, it's been a lot of focusing on the process and of getting those patients in and out of the clinic. So the conversations have been kind of around how the doctors can still stay focused while in the operatory working with the patient, as well as communicating with their staff, whether it be that they're at home right now or if they're still in the office and still at the reception desk. So a lot of offices have been looking at that internal communication. One thing that I've always pushed with those offices is just make sure you know where that information is going. On offhand, you're going to think it's internal communication, and it's just a sentence here or there. Though throughout those conversations, you'll be dropping information about patients' health information. So that's something to keep in mind, how that's getting access to the internet and where it's being stored at the end of the day. So that's been basically the concept of my conversations, and the way that offices in Eastern Canada are starting to get back together and starting to open those doors. It looks like everyone's trying to fit in all those requirements that are coming out, and I predict within the next 2 weeks that if anything, I'd say 3/4 of all offices that are currently closed are looking to open their doors back up. And I can say it's helped offices for planning, as we spoke about previous webcasts, where they were trying to revise all processes, make those lists beforehand so then they can start and jump right on into it, and just trying to listen to other regulations from other provinces. Sure, it may not be their own regulations, but it gives them that head start that they would need to kind of get the advantage when it comes to reopening that office. So that's all I've got for this week. Back at you, Alex, if you have anything to add for that.
Awesome stuff, Mike. Thanks. And yes, of course I do. As you were speaking, I think offices that are back in the office now, and they are seeing an influx of calls coming in with concerned patients. That is a side effect of you not proactively communicating with your patients. They're hearing in the media or from their friends and family, whatever, that offices are about to open, and they're calling you concerned about what's going on. That just means that they don't know. It means that you didn't tell them. So if you haven't been listening to our previous webcasts, or the many other qualified people in the industry who've been urging you to communicate with your patients, then now you are basically facing the repercussions of that with fielding a lot of calls. Now, when we're talking about rebooking your schedule, there is basically two schools of thought that I've seen right now. Mainly coming from the US is the school of thought of you have to book as a priority the patients with procedures that will generate you the most amount of money, because you have sustained losses And in order for you to stay in business, you need to obtain revenue as fast as possible. I am extremely against this school of thought, just because you are in the medical profession, and just because a patient has to undergo a procedure worth $2,000 does not necessarily mean that it is the priority for you as a healthcare provider. So the second school of thought, which I highly recommend to everyone to employ, is a triage similar to a field medic or a field doctor. You have to canvass your entire patient base and assess their perio and resto needs with regards to the risk that they are exposed to if goes untreated. And we're going to talk more about it through today's webcast as well. But bring the ones with the highest priority first and move down the list. And you don't have to do it alone. You have a team, whether you have associate dentists, whether you have a team of hygienists that know the patients well. This is what you need to do. You need to triage and address it by the medical priority that it has. And if you do this right, then you're going to get, a good reputation, which just means that it's going to strengthen your business for the long term. So that's what I always recommend on doing. So I think it's very important to make sure that people have their priorities straight. And again, some people are going to say that prioritizing money is good for me, and it's okay. It's their business choice. We can't have all the businesses operate the same. So it's the individual decision of each owner. But if you're in it for the long run, I would highly recommend focusing on healthcare priority. So in terms of doing the rebooking, we're now looking at what's going to happen with regards to the pre-screening, how to properly do it, and what other things in reopening from an overhead standpoint do we need to keep in mind, and not just bringing the patients back. And to talk a little bit about that, Jay is going to share some of his experiences in the past week with his clients.
All right, perfect. Thank you, Alex. And again, hi, and thank you for for watching and being with us on a Friday, accompanying us every time. So yeah, the conversation that I've been having this week is mostly our clients that wants to go, that are reopening and that had placed their subscription, their support subscription on hold and reactivating them. So that is something that you may want to like with all the business and preparation for reopening, getting a hold of the PPE, writing your protocols and processes. Well, this is something that may be left behind. Are those things that that people grabbed, during that time when a lot of businesses were offering help, like for example, insurance, or like deferring payments for whatever billing that you guys have. Make sure that you guys jump into that and make sure that it gets taken care of, so that when that time comes, you guys don't have, there's no interruption of whatever service that is, including I myself, like here, I don't know for Ontario, but then I know here in Manitoba, a lot of people had, since a lot of people were working from home and they were laid off and things like that, they had changed the insurance to like just leisure only, just to save a couple of dollars, right? So for the staff out there that is going back to work, make sure you don't forget about switching that, right? Or switching back to whatever you had before. And again, like what I mentioned, the monthly subscriptions is like for your IT companies, or whatever plans, billing plans that you guys have with with or business relationships with other companies. So make sure that that is not put in the back. So just to make sure that your reopening goes smoothly, right? Because these are some things that may we may forget. So when it comes to the reopening and the new processes, a lot of phone calls, a lot of conversations was also about pre-screening. So there were some offices that was really good at it. There were some offices that was that was just still testing. How are we going to do our pre-screening? And this doesn't this one particular conversation. It didn't come up before when they were only screening one patient, but then there was a family of 6, and they had to read every single item over the phone and pre-screen. And after that, they found out, okay, well, this we can't do this because there's so many things that needs to be done in the office. And yes, this is important as well because it's something that needs to be done and documented. So there are options. There are a lot of options, but then this is just based on these offices that have done it. Again, this may the process for pre-screening that I'm about to mention may be tweaked, and this needs to be reviewed as well. And you have to do it cautiously. And the reason why I say that is because these are information that you're collecting, whether via email, via phone, or through a website. So this specific one, they're planning to put this questionnaire, because I know for Ontario, ODA had came up with the pre-screening questions, and then they have to mention that, and there's a field in there that would say email, how did you screen it, whether via phone, email, or other. So again, that phone call, they're they found that office that I was talking to found it exhausting to mention that every time, and then especially for everybody, right? If there's a lot of them. So the option that they were looking at is put that questionnaire in the website. Either they print it and then bring it later on, or fax it or email it, and then after that, then they can proceed with booking the appointment. Other solutions will be just simple telephone, just a traditional way of doing a phone call, and then just documenting that in your system, in your practice management. And then another thing would be this particular office created a form. So what they did is instead of just having them go to go to our website and then just read it, so they actually created a form online. So there are a lot of platforms out there, and again, you have to do this cautiously because of we have to take note of the Privacy Health Information Act with whatever information that you're trying to collect from your patient. That it doesn't have it's I know it's difficult how not to say that what information you're going to be putting in there, because definitely it's going to be identifiable. But that's where I mentioned the disclaimer that we have to do it cautiously. And so what they did was they had our system, our reminder system in the text. So of course, if it's a text, it's just short, right? So they created a form, they put it in the link, and the patients would just go to the form, put answer the information, and then they collect that information. So to them that works well. So and then again, there's so many things that needs to be reviewed in that way of collecting, because I don't know if for some of you listeners or viewers out there, we've had several talks where we were talking about the Health Information Act, right? And Alex, being our privacy commissioner, Like I don't want to misquote him, and he did the talk. So I'd pass this on to Alex to just give you a little overview of what that is, like what information you guys have to be aware of. So Alex, go ahead.
Thanks, Jay. And not yet a commissioner, just
Oh,
officer.
yeah. Well, so, in our, I see him as the commissioner in our office. He's knowledgeable with all these privacy information.
For sure, for sure. So I guess there are a few things. So when it comes to collecting any type of information in your clinic, it needs to be separated into personal information and health information. They're treated differently, just based on the sensitivity of things. Um, so first of all, we need to understand what is identifiable health information. So identifiable health information is any combination of pieces of information that would allow an individual to uniquely identify a person. Now, what those combinations are, there's no definitive answer because you can identify a person given a variety of combinations. So it's within reason or what is reasonable, and what you need to think about is what is going to help you defend yourself in court or when you stand in front of an umpire. So the reality is, if someone submits medical information about themselves, just about conditions, have you traveled here? Did you have fever? Like all of the questions that we have on the pre-screening form, but they don't have any personal information there, then it's not identifiable because you can't really identify which person it belongs to. If you add their, social insurance number, then you potentially can personally identify them. What if you just add their first name? Well, it depends. If their first name is John, then probably no. But if their first name is extremely unique, then potentially someone will be able to identify this person. So these are the questions you have to ask yourself. Now, you're going to go into this, really deep rabbit hole that you don't want to. So there are many elements that, you can, first of all, you have to decide for yourself, similarly to what I mentioned earlier when Mike was touching on, rebooking, is are you doing the pre-screening because you really believe that this is going to help protect your staff and your patients and yourself? Or are you doing it just because the college asked you to? So if you're doing it just because the college asked you to, then you probably don't really care about any privacy or anything. You just care about making sure that you have a record to show the college that you've done exactly what it is that they asked for. So if that's the case, I'm assuming that nothing that I'm going to say, right now is going to be relevant. But if you are doing the pre-screening because you really believe that this is going to help protect the people inside your clinic, then you need to think about, is this form enough? Because there are different patients. You have patients that are truck drivers that are going to the US. Other patients that might be essential workers that are basically exempt from self-isolation. So you need to understand what is the nature of your patient and what pre-screening process or protocol or questions you need to incorporate when you are having a conversation with them. Now, let's be honest. You're going to see less patients right now as you reopen than you used to when you were fully booked before the pandemic. So there's going to be less patients coming in. And as such, doing it on the phone is not a bad idea because you can actually have a conversation and ask follow-up questions and not wait until the patient is in the office. The other component that is important here is I know of a few offices that I've been working with that are able to record all of their conversations. So if you're doing a pre-screening conversation with a patient, that call needs to be recorded and stored as medical information, identifiable health information. So it needs to be encrypted, it needs to be stored, and that you're able to retrieve it if needed. But that's, if you really want the best way of doing it, this is the best way. Now, there are other ways, like Jay mentioned, you can use, because here's the deal. You're not going to be pre-screening all of your patients. You're just going to be pre-screening the patients that are expected to come to the appointment in a few days. So as such, you should be able to leverage your appointment reminder system and help the patient fill in their pre-screening. Now, if you're going to use that, I recommend adding statuses to your appointments. So you would have a status for pre-screened through phone, pre-screened through email, or whatever that makes sense. So at a glance at your schedule for, let's say, Tuesday or Wednesday next week, you should be able to see at a glance who are the patients that you still need to pre-screen in case that you weren't able to get them on the phone, or they haven't replied to the email. So now, from a privacy standpoint, what you want to make sure is whatever it is, the form that you use to collect it, whether it's a audio file or a PDF or whatever form using a third party, you have to make sure that you know where the data is stored. You have to make sure that it's encrypted, yet at rest and on the move, and that you know who has access to it at any time. Now, if you're using something like free Google form, then you have to really read into Google's terms and conditions for that service and make sure that you as the custodian feel confident enough with their terms and conditions and where it's stored and who has access to it and all the elements that I mentioned. So those are the questions that you should ask yourself, because you might be doing what the college asked you, but you might be incurring some risk that you might or might not want to incur. So that's kind of my 2 cents or maybe 20 cents on this privacy thing in pre-screening. But I think you have to determine for yourself what is the purpose of you collecting this, and then develop a process of doing it that works for said purpose. So I think that's, to me, that's the most important when you're considering a process. Good. So moving along to our next topic, and that's patient flow and regaining income. So we touched a little bit about health priorities versus income, but one of the big things is that the way we check in patients, the way the patient moves around, and the resources that are needed to make sure that we do it in a safe way is changing. And offices are trying to figure out what is the process that works for them with regards to their own provincial guidelines, plus the layout of their offices, and everything else. So on that, James is going to share some of his conversations with his clients in the past week or so.
Okay, thank you. Thank you to all of you. Thank you for tuning in as well. I don't know if you can see in the background, my cat is having a loving moment here with me, so she keeps trottling through. I'm sorry. Yeah, it's been a crazy week. A lot of information all being passed and happening all at once. A lot of offices that are either just getting ready to start opening up, or they already have opened up. There was some information I know with the BCDA. There was a media release on May 29th with a doctor that I've had a good relationship with and talked to in the past, Dr. Alistair Nickel. It's talking for the most part, why the phase guidelines seem to be relaxed compared to other provinces. And it goes a little bit more into depth. I'm just going to bring it up here quickly, so if I disappear, that's where I'm at. And it really just goes over that again. In some of the places within the province where low instances have hit, it's not that the need for PPE and for preparation is any less. It's just it's not as required, but you do have to again follow whatever guidelines provincially that they've set out. And again, the BCC, DC, and WorkSafe BC have outlined those guidelines for you. One thing here that it shows that I wanted to mention is dentists have been highly trained experts in infection control for a long time, and I believe that you have to remember that at the end of the day. As it evolves, the dentists have enhanced their infection control protocols to follow public health orders as per current phase 2 guidelines, depending on the specific nature of the dental treatment and patient risk factors. Members of the dental care team require varying levels of PPE to keep everyone safe. And based on the BCC DC guidelines, where there's a low instance and prevalence of COVID-19, additional PPE over and above that required for normal precautions is not required. So again, that's what we're getting from the media release from that end. But just to touch on something that you said, Alex, earlier, when you said, treating everything like everyone has COVID. And I really think that's a good mindset to have. The challenge with that mindset, though, as I was thinking through, is anxieties, right? And we all go through their own set of anxieties. COVID-19 has set off many anxieties for a lot of us that I think we didn't really know that we had. But from a patient standpoint, being a patient, like I've had anxieties with dentists in the past as well. And I think that the main thing is, it's like I've spoken about before, it's not just the care factor, it's how you're responding to the call of need for these patients. Are you doing all the proper steps that you need to do? Is that self-assuring to patients? Are you asking patients on when they're leaving, hey, how did everything go? Did you feel that everything was kind of clean and perfect? Like, those types of questions will give you that feedback. And although, again, we've talked about this with politics and different regulations coming out of different provinces and conflicting information, the smartest thing to do is do everything that you can to keep you, your families, your office, and your patients safe at all times, and research out information on specific key things as they come through. I've mentioned before, not only as kind of a disclaimer, but if I'm in BC and I'm looking at Manitoba's guidelines, and Manitoba seems to be a lot more tight, and that kind of falls in line with what I want to do, then do what you need to do. That only makes sense. You just don't want to look at something and say, well, they're not doing it over there, so I'm not going to do it over here. It's not even the risk and exposure legally or anything like that that matters as much as it's the health impact. And again, it was mentioned earlier in this podcast as well that we talked about basically what you're hearing in the media, and more so if someone medically is found to be contracting the virus because of low protocol following and things like that, then it's just, again, a risk that you just don't want to have your name dragged through the community. And the sad thing is a virus like this, it's so hard to determine where you can catch it and things like that, and people are asymptomatic. So you need to do everything that you need to do right now to make sure that that's protected until that part of that the system is trusted a little bit more, and that's only something that time can kind of give you. And that we enhance our guidelines as we go through, and we minimize protocols for viral infection as things get better or vaccines introduced. Like, all these things will come, but for right now, this is the main focus. And I implore people not to not listen. That's more or less what I'm trying to get at. A lot of my conversations over the week, they fall in line with this. We talked about, I think you changed FOMO, the fear of missing out, to FORO last week, Alex, fear of reopening. And it's true, right? A lot of the conversations I've had this week, and I've just got some quick notes here. or basically been on like reopening preparations, how the patient flow is going to work, rebooking priorities. And then when we talk about rebooking priorities, and we spoke about it a little bit more here earlier as well, but you want to be keying in on the most priority care. And I know that you already know that for the most part, but there are some offices that are kind of still in, I didn't bring in my receptionist or any admin, 2 weeks before I opened to kind of get these bookings through. I opened my doors today and I'm just doing everything on the fly. Well, if that's your case, like I understand based on, that's what you wanted to do, but you have to keep in mind who should be there first and foremost to receive that care. And again, that's most priority care is number one. I have some doctors that behind that priority care, they're booking for bigger procedures. Again, as a revenue generator for right now, there's been a lot of lost revenue. You want to make sure that everything is still standing and concrete, for the long-term future. And for right now, just making sure that you have that revenue generating is also a key thing as well. Making sure that you're always keeping your eye and communications open with all your patients, whether it's a 3, 6, 9 month recall. And that's more so for obviously for any future oral health concerns. But that's also just to keep in touch with them to make sure that they know, hey, if something's happening or something's degrading, please come in, please see us. We want to do the work, but we're going to do it as safe as possible and we'll book you in accordingly. Or again, if it's an emergency procedure, they may have to be rushed in. But again, keeping that communication channel open with them, that's the main focus of everything. And I've had a few talks with people, with offices who have talked about, I've lost clients and patients over the years. I don't know how they seem to fall through the cracks. I don't know if it's an admin thing or we're not entering in something properly, whatever it may be. Basically, what the theme is that I'm getting back is they want to do some sort of reactivation campaign to reach out to anybody who they may have missed. I know within our software there's a patient listing report where you can go and pick a date range, go back 12, 18 months and see all the patients who didn't have a follow-up recall or a follow-up booked appointment and somehow got missed through the times of being busy. We're not busy right now. We're busy in a different way because we're all learning what we need to do as we go. But we're not busy in the sense where we have all those patients being intake. So I would say that doing a reactivation campaign right now would probably be on the lower priority scale. But again, it's something that you don't want to neglect. And if you do have that capability to get those listings and to go over, and you have, like for us with Maxi Reminder with the patient communication program, it's just a matter of setting up a template and sending out a mass message to all those patients and getting them to communicate with you and just following up, seeing if anything has gone on over that time that they've missed their last appointment or you haven't talked to them. They may be in a worse situation. They may be in a situation where they need your help right away, or things may even just be good. And it's something for down the road. But again, you don't want to leave your lost leads or those generated people that you've had a relationship with left out in the dust, and you want to make sure that you're communicating with all of them. I've had a conversation about charging for PPE. I know, Alex, you're going to touch on that in a few minutes. It was kind of a different conversation because it really took a different road in the sense of the doctor had said to me, the public has views of dentists as being just money makers. Like that's all we do. We've just got all the money in the world, and we're just going to pay for all this. And after talking to several offices, this is going to be a struggle for a lot of offices, whether or not that they're going to pay for it solely, or if they're going to pass the charge, or however that they're going to want to go ahead. Like I said, I know Alex will dive into that a little bit more. And I understood that. Right. And like I said to him, I said, the dentists and the public have views about account managers as being solely salespeople, when we're not. We're advocates of information, just like you are. You're skilled at your skill set and you do what you do. And the dentist, having a dental office doesn't mean just because you're skilled in the trade that you're amazing at business. There's a learning curve through it all. Some people have those things. Some people don't have the tools in place. But when you start reaching out to everyone around you, you start building your business on a better vision. And it was a good conversation going back and forth. But like I said, there are some concerns there, and we'll address that in a few minutes. The rest of the conversation have basically been on add-ons and things like that when they get into when staff comes into the office and they have a set plan of, okay, this is a touch point, this is a touch point, like you go over everything and then you come into like a real life scenario and you look around, you're like, wow, I didn't think about that door handle, I didn't think about that chair. There's other things that are there only when you're in the live environment that you're going to see. So I've had a few calls this week based on, well, how can we get this implemented as soon as possible? We're either opening our doors today or within the next week. So I've been motoring through some conversations with that. And then again, lastly, security is the biggest thing. And it's not that I found it funny that we talk about this in length, because again, and this just goes back into the same conversation Jay was just having with identifiable information, and you being the doctor and the owner of your business being the custodian of that patient record, that patient medical record, is that over the break, I think it gave people an opportunity to kind of sit and rethink their current plans. It's very easy to go, well, what's this big buzzword about ransomware? Let me check this out. And then you read 3 articles and you're scared to death about even touching a computer again, right? Like that's a reality. I know when I started reading articles on it, when it first kind of came to be, I was like, wow, this is terrible. But it's a reality of what's out there. Now, is it a real life threat? Of course it is. Does it happen to everybody? No. And the thing about things like that, it's just like a criminal. It's always a random act that nobody saw coming, right? And that's kind of the thing that you want to avoid in these conversations that I've been having. It's more like people are now starting to understand the impact of what it could do and how it can cripple you in a heartbeat, and the real threat of what it poses just by being able to get into your system, lock everything up, and basically say, you pay us X amount of dollars and we'll give you the key for it. But, a thief's a thief's a thief. At the end of the day, you can pay them their money. That doesn't mean that they're giving you your key. And then what do you do, right? So reevaluating your security and what you have is your services for backing up your information. We've talked about this several times. Key thing for here in Canada is making sure that all those transmissions that go from the point of your office to whatever server and cloud platform that's saving it, that all the transmissions stay in Canada. You want your server locations to be within the same country of origin. You don't want things crossing borders. Is it encrypting at the time of when it's pulling that information, and is it re-encrypting it or de-encrypting and re-encrypting when it gets to the cloud portion? All these things, they matter, right? And at the end of the day, we can talk about all the things in the world, but if you're exposing yourself to that type of risk, that it's mind-blowing that there's still some offices out there that it's just not a consideration. So I'm glad that in the conversations that I've had, that this is kind of coming a little bit more to the forefront. I know that I've had some conversations with offices for the last year or two where we start talking about things, and it's a to-do implementation. But right now, I think when you start everything up, and I know you're trying to be cost effective, this should be in your forethought, is security at every point in time. And again, just to my point, like I said earlier, with the dentist, that the public have view on account managers as being salespeople. I'm not trying to be a salesperson here. I'm just trying to be a proprietor of information, again, that when we open up these conversations, that we can have these talks and we can plan things out with you. Nothing's about money as much as it's about our relationship. And at the end of the day, if we don't have that relationship or that trust between us, it's going to be very hard for you to get the right information when you need it. So I want to make sure that that's kind of a key point that I highlighted on today. and that all of us are doing when we have our conversations as well. So again, I implore everybody to reach out. We're trying to reach out to as many people as possible. Obviously, it's extremely busy. There's times where I get off my phone, my voicemail's full. By the time I check my voicemail, I've got 2 more messages. But we're going through this together. We're making time where we can to have those conversations, and just making sure that we're all in constant communication. Politics and stuff like that, it's tough. It's part of the real world scenario as to where we live in. I understand how provinces want to have their separate associations. I understand governing bodies and things like that, and things don't always make sense. But right now, I think the best way to make sense of everything is to be sensible to the information that's out there, protecting yourself, protecting your family at the end of the day, protecting your teammates, and protecting the general public. And I feel that if you take that precaution, you will be successful in your endeavor, and we will get through this as unscathed as possible. So that's kind of what's been going on in my world.
Good stuff, James. Thank you very much. And yeah, well, you're right. There's a lot of things involved, but and I know everyone's anxious, staff-wise coming back. But I mentioned this last week or the week before. You guys work in the healthcare profession. You know that you're going to be at a higher risk when it comes to bacteria, viruses, and everything else. It's just you're afraid not because you didn't know that you're going to be at a higher risk. You're afraid because this is a strain of a virus that we've never done before, and no one's really clear as to what needs to happen so you would be protected. So the conflicting guidelines or the misinformation on social media is not helping. But you're not working in a dental clinic for 15 years and only now discovering that you have a higher chance of contracting disease. Like, I don't think this is news to anyone. It's just a little bit more challenging because there's not enough accurate information and research about it in terms of how to protect. And having political arguments just shows you that the body that governs your profession might have other interests in mind than public safety, and that gets you thinking thoughts that would for sure get you anxious. So again, it is what it is. That's the reality. Just need to operate within it. So but yeah, James was right. What I want to touch base on today, and I promise it's not going to be long because we're kind of 1 minute before 2 p.m. Not that we turn into a pumpkin after, but just don't want to consume a lot of your Friday time prepping for the weekend. But yeah, I'm my conversations with staff, office managers, dentists this week was with regards to PPE surcharge. We've seen the Denturists Association of Canada publish a procedure code with regards to a PPE surcharge. They are the fees across the provinces that I've seen so far is $30. That is per patient and has to be billed separately. I'm assuming that some of it is going to trickle down to other associations. I know that associations have already been in conversations with the insurance companies of how this is going to work. And I can almost guarantee that the fee guide of 2021 is going to include a substantial increase across the board for all procedures, probably to offset some of the increase in the overhead and not just the PPE. But I've mentioned last week that there are offices that reopen and got killed on social media when they decide to charge extra for the protective equipment. Since then, and Jay has mentioned some conversations he was having where the offices just increase their fees in general to compensate for that. Again, there's some calculation and there's some administrative overhead in setting it up properly, so your insurance breakdowns don't get messed up. But my main point that I want to get across today is free exams, and I mentioned this to people, a couple of months back when they were asking me like how do we bounce back from this situation, and it's become more and more apparent because I said free exams before there were any guidelines of coming back. And I still stand by free exams, and I'll tell you why. I think that there are a few aspects that are extremely important that free exams to your patients are going to help you with. So, first, you're going to have more people willing to come because an exam is not a procedure. That's A. B, you are going to have more people coming to your office for non-aerosol producing procedures that will test your process and patient flow. Another reason, you're going to have people come to your office and they are going to be exposed to your new process and flow and not undergo a procedure. So the next time when they do come for a procedure, they already know what to expect. So they're less anxious and more willing to actually undergo the procedure. Another thing is, people had certain conditions and you have diagnosed and decided to treat them, and then the pandemic hit and you were not able to treat them. Now, what's basically going to happen is that condition might have changed, and as such, you are going to encounter potentially a worse condition when you get them in. The idea is you cannot determine what is the priority of patients based on information from 3 months ago. And the reason is because not only that their condition has been untreated for 3 months, potentially, unless they had an emergency, or that you can't really prioritize properly. Anyway, so what's the thing is, you want to create a benchmark where if you decide to go through priorities in how you book the patients, you are basically going to have to get a benchmark for all of your patients, up to date benchmark, and then start prioritizing what needs to go first and second and etc. So I think from all of these aspects, now I'm not even talking about a reputation benefit whereby this is going to be spread. So instead of social media killing your business by shaming you for putting more charges on people after they have been laid off, you're actually going to get some positive social media potentially, or if not word of mouth, where they're going to say, I got a free exam, they told me this and this, they gave me a toothbrush, I don't know, whatever. Or they didn't give a toothbrush, it doesn't matter. But it's a benefit for both the patient and for yourself. So to me, it's a no-brainer. Yes, it's going to have an impact on how quickly you can regain income. But the reality is that again, if you have the long-term game in mind and you want to be a pillar of the community, then this is what you do. This is the right thing to do. So to me, that's what I feel needs to happen. But again, every business owner is going to decide what is good for their own unique situation. So these are just my recommendation with regards to why I think this is the right thing to do. So yeah, guys, anything else you want to add? No, and no. Awesome. So thank you very much to everyone for joining us and
Your daughter
sitting
has
through.
something to add, Alex.
Sorry?
Maybe your daughter has something to add.
It's okay. We will talk to her about this later. But yeah, thank you everyone for watching. It's a pleasure, like every Friday. We will see you again next week. Until then, stay safe and don't have fear of reopening. We're gonna get through this together. So thank you very much, and we'll see you next week.